Diet and lifestyle changes are the first-line therapy for chronic constipation. Increased dietary fibre and water intake and physical activity are typically recommended before laxatives or medications. 90% of Americans don't consume the recommended daily amount of fibre. The average fibre intake for Americans is about 16 grams daily, but the suggested intake is 22 grams for a woman over 50 years of age and 28 grams for men over 50. Increasing the fibre intake is easy, it's cost effective, and in many cases it cures the constipation. In a trial with 117 people with chronic constipation, a diet containing 25 grams of fibre per day for 2 months resulted in increased stool frequency and decreased laxative use. The improvement was more pronounced in a subgroup of participants who were instructed to drink 2 litres of mineral water per day, compared with those who were told to drink as much water as they wanted. Another preliminary trial found that eating breakfast containing 5.4 grams of fibre, mainly from wheat bran, daily for 2 weeks had beneficial effects on the bowel function in people whose regular diets included less than 15 grams of fibre per day. Improvements in constipation, bloating, sluggishness, and digestive comfort were noted. Many other trials of various forms of supplemental dietary fibre have also demonstrated improved bowel movement frequency and a clinical benefit in constipation. In addition to consuming plenty of fibre and staying adequately hydrated, a few specific foods can improve bowel regularity. Prunes or dried plums have long been used to treat constipation, and it's thought their laxative effect is part due to their high concentration of sorbitol, a slowly digested sugar that has an osmotic effect and holds water in the intestines. Kiwi fruit is a traditional laxative food. Several clinical trials have found eating kiwi fruit can relieve constipation. A preliminary study tested the effects of mineral oil, olive oil, and flaxseed oil in 50 dialysis patients with constipation. The participants who were given one of these 3 oils to take daily for 4 weeks at a dose of 1 teaspoon per day. All 3 had reduced constipation scores, with olive oil demonstrating some superiority to flax oil. These results suggest edible oils might be a useful alternative to mineral oil for the treatment of constipation. Increasing fluid intake is an effective treatment for constipation. In addition, water and fibre appear to work best together. Water restriction has been demonstrated to rapidly reduce bowel movements in healthy people, and low fluid consumption has been associated with an increased risk of chronic constipation. In individuals living in nursing homes, low fluid intake is an important factor that predisposes one to constipation. Hydration may be especially important for those with Parkinson's disease, a condition that's associated with elevated risk of constipation. High mineral content water might be more helpful in treating constipation than typical low mineral water. In a 4-week study, women with chronic constipation were given 1.5 litres of drinking water per day. They were divided into 3 groups based on the composition of the water they received, which contained either 1 litre, half a litre, or none of a high mineral natural spring water. By week 2 of the study, the women whose daily water included 1 litre of the mineral water had better stool consistency and less use of laxatives than the women in the other 2 groups. The response to treatment corresponded with the concentration of magnesium and sulfate in the mineral water. A sedentary life is a major contributor to many chronic diseases, including constipation, and a recommendation of regular exercise is part of a standard management of the constipation in adults. In a study in which experimental bed rest was imposed on healthy men for 35 days, 60% developed constipation. Other studies have found that exercise interventions can successfully improve chronic constipation. In one study in 43 participants with chronic constipation, 30 minutes of brisk walking twice weekly, plus a daily 11-minute strength and flexibility program for 12 weeks led to a significant reduction in most of the constipation symptoms. In a study designed to determine the ideal posture for ease of defecation, 28 healthy adults adopted 3 different defecation postures, each for 6 consecutive bowel movements, and they recorded the time and the ease of defecation. The first posture was seated on a standard toilet. The second was seated with the feet resting on a 10 cm high footstool, and the third was squatting using a flat container. For all of the participants, squatting was associated with the shortest time spent moving the stool and easiest sensation of bowel emptying. According to the study's author, the straightening of the recto-anal angle that occurs with squatting is the natural posture for defecation. Researchers assessed a chronic constipation education program in 35 chronically constipated women. The program guidelines were to consume 25 to 30 grams of fibre per day by eating fruits, vegetables and whole grains, drink 1.5 to 2 litres of fluid per day, preferring water and avoiding diuretic drinks like alcohol, to incorporate regular exercise in the form of walking, with a goal of 3.5 to 5 hours per week, to use the toilet at the same time each day, whether or not there was an urge, and to use a squatting posture to promote proper defecation. After 3 months, measures of constipation symptoms and severity had improved significantly. The gut microbiome is increasingly recognized as a key factor in the functioning or the malfunctioning of the entire digestive tract. Probiotics are supplements containing live microorganisms that are taken to improve health. Probiotics are effective in treating a wide array of digestive disorders, including chronic constipation and irritable bowel syndrome. They can also have important effects on the immune and the metabolic health, broadening their potential therapeutic use to include the prevention or the treatment of such diverse disorders such as allergies, infections, skin disorders, heart disease, type 2 diabetes, obesity, depression, and neurological disorders. Many individuals with constipation show alterations in their gut microbiome. The most consistent findings suggest those with IBS have fewer bifidobacterium species and related bacteria in their intestinal flora. Probiotics, most of which contain strains of lactobacillus and/or bifidobacterium, can help to relieve the constipation by their ability to favorably influence the gut microbiome composition, to reduce intestinal inflammation, and to promote healthy intestinal motility through their effect on the enteric nervous system. Evidence from randomized controlled trials and meta-analyses indicate that specific probiotics can improve the gut function and can reduce the symptoms in those with chronic constipation and IBS. For example, one meta-analysis that pooled findings from 15 randomized controlled trials with a combined total of 2,327 participants found that mixed probiotics shortened the gut transit time, increased the stool frequency, improved stool consistency, and reduced bloating. Nevertheless, the optimal probiotic strain, dose, and duration of the treatment has not yet been conclusively identified. Bifidobacterium lactis is a probiotic species, and it's been widely studied and it's demonstrated particular promise for treating constipation. Bifidobacterium lactis supplements might work in part by increasing the number of endogenous colonic bifidobacterium species in constipated adults, and this effect may be enhanced by the addition of a prebiotic fibre, such as INULIN. In a randomized controlled trial in 156 subjects with functional constipation, a supplement providing 10 billion colony-forming units of B. lactis with other strains showed relief in the digestive discomfort better than a placebo after 2 weeks. In a randomized controlled trial with 47 participants suffering from constipation and long transit time, consuming a yogurt that contained polydextrose and at least 1 billion CFUs of B. lactis and L. acidophilus for 2 weeks shortened the transit time, and it reduced constipation symptoms compared with non-probiotic yogurt. Another randomized placebo-controlled trial that included 228 participants with functional constipation found the B. lactis alone at a dose of 10 billion CFUs per day for 1 month increased the stool frequency, and it reduced straining in a subgroup of those who reported 3 or fewer bowel movements per week at the baseline. B-lactis was also shown to reduce the transit time and to relieve the symptoms compared with a placebo in a trial with 100 participants whose average stool frequency at baseline was 1 to 3 per week. In this trial, a daily dose of 17.2 billion CFUs was more effective than 1.8 billion CFUs. Eating 30 grams or 1 ounce of cheese enriched with B-lactis daily for 30 days was also found to reduce the constipation symptoms in a small control trial with 30 female participants. In an open trial taking a fermented milk supplement containing a combination of B-lactis and L-casein for 4 weeks led to reduced constipation symptoms and decreased inflammatory cytokine levels. However, not all probiotics or even all strains of B-lactis have been found to have beneficial effects on constipation, so it's important to use a probiotic with a clinically validated strain. Magnesium is an age-old remedy for ameliorating constipation. In fact, magnesium sulfate, commonly known as Epsom salts, has been used for this purpose for over 350 years. Magnesium is an osmotic laxative, drawing water into the bowel and provoking the need for elimination. In adults and children, randomized controlled trials have shown magnesium supplementation to be safe and effective for improving chronic constipation. In adults, one of these studies found in Japanese women with mild to moderate chronic constipation 500 milligrams of magnesium oxide taken 3 times per day for 28 days significantly improved the frequency of spontaneous bowel movements, colon transit time, and the Bristol stool type compared with the placebo. Symptoms overall and constipation-related quality of life were also significantly improved. In a 3-arm study of 90 adults, the majority being female, with chronic constipation, 28 days of treatment with 1,500 milligrams of magnesium oxide was compared to 1,000 milligrams of senna or a placebo. There was a significant improvement overall in the 3 groups who were treated with magnesium oxide and senna compared with a placebo. Multiple clinical trials in children have found magnesium oxide improved the constipation comparable to probiotic treatments. Because mild abdominal discomfort can occur with magnesium use, it's best to titrate or divide the dose during the day. Excessive use of magnesium in individuals with constipation, particularly those with late-stage chronic kidney disease, can lead to hypermagnesemia. Those taking additional laxatives and using magnesium in excess of 1,000 milligrams per day are at a greater risk of this adverse effect. In healthy individuals, the kidney filters 2,000 to 2,400 milligrams of magnesium daily, and there's little risk associated with lower doses of magnesium for laxative purposes. Instead of relying on chemical laxatives, the proper nutrient intake at the right time can support the soft fecal consistency and induce colonic peristaltic action without serious adverse effects. There's convenient powdered formulas available that contain magnesium mixed with ascorbic acid, and they can induce a bowel movement relatively quickly, typically within 30 to 90 minutes. A teaspoon or more of vitamin C and magnesium crystals will evacuate the bowel within 30 to 90 minutes if taken on an empty stomach with several glasses of water. One of these powdered formulas provides 4,500 milligrams of vitamin C and 250 milligrams of magnesium in each teaspoon. The dose needs to be individually adjusted as to not cause all-day diarrhea. Buffered vitamin C powders combined with primary potassium salts can work as well as magnesium vitamin C powders, and they might be used on alternative days for those who need ongoing relief. The suggested number of times these nutritional colon cleanses can be used is about 3 times per week. Excess use may create tolerance and require higher dosing. Soluble fibre supplements absorb water and they hold it in the intestines, keeping the stools soft and easy to move, and they tend to create a lubricating film when exposed to water. Insoluble fibre supplements add bulking particles to a stool and they shorten the transit time by stimulating peristalsis. Soluble fibres are generally fermentable, which means they can be digested by microbes in the intestines. This quality is referred to as prebiotic. Prebiotic fermentable fibres are important for establishing and maintaining healthy colonies of beneficial bacteria in the gut. Soluble fibre is present in psyllium husk, legumes, nuts, seeds, and some fruits and vegetables. Sources of insoluble fibre include wheat bran, whole grains, and vegetables. The husk of the psyllium seed, a product of the plantago plant, is rich in soluble fibre, and it contains some insoluble fibre. Many well-designed trials have demonstrated that the psyllium fibre supplementation relieves the constipation and irritable bowel syndrome. Psyllium has also been associated with increased stool frequency in constipated Parkinson's disease patients. In patients with chronic primary constipation, taking 5 grams of psyllium twice per day improved stool consistency and frequency. In one clinical trial, 5 grams of psyllium per day was shown to be superior to docosahexaene sodium as both a stool softener and a laxative. In fact, psyllium fibre supplements are FDA approved as laxatives. Psyllium should be taken with a full 8-ounce glass of water and be accompanied by adequate fluid consumption throughout the day. It's considered best to introduce it slowly. Psyllium has several ancillary benefits as well, including improving the lipid profile, glucose metabolism, and blood pressure control. Although psyllium is one of the most common and most thoroughly studied types of supplemental fibre, several other fibres can be used to supplement the diet. INULIN is a prebiotic soluble starch and it functions as fibre in the digestive tract. INULIN is found in many plant foods, most notably in the Jerusalem artichoke and chicory root, but also in more commonly eaten veg like onions, garlic and asparagus. It's considered a prebiotic fibre because of its positive effect on the colonies of beneficial bowel bacteria. A rigorous analysis of many randomized control trials concluded supplementation with INULIN can decrease the transit time, increase stool frequency, and improve stool softness in people with chronic constipation. Guar gum is a product from the guar bean. Partially hydrolyzed guar gum is a soluble fermentable fibre, and it's more palatable and less likely to cause adverse effects than whole guar gum. Preliminary research shows that supplemental guar gum helps to relieve constipation symptoms in patients with constipation-predominant irritable bowel syndrome. Glucomannan is a soluble fermentable fibre and it's found in many plants, especially the root of the cognac plant. It has prebiotic effects, supporting the beneficial bacteria in the large intestine. Several clinical trials have shown that glucomannan improved multiple measures of constipation better than placebo. In a preliminary study that included 114 elderly subjects who lived in nursing homes and had constipation, the addition of 1 to 3 grams of pea fibre powder to other foods 3 to 4 times per day for 6 weeks significantly increased the stool frequency and decreased the laxative use. Flaxseed is a source of both soluble and insoluble fibre. The soluble fibre is the outer coating of the flaxseed and it's a mucilage and it becomes slippery when wet. Mucilage, like all soluble fibre, increases the moisture in the stool and it's thought to have lubricating effects. Cascara, or the bark of buckthorn tree, has traditionally been used to treat constipation, like senna, which is commonly used as a stimulant laxative in the conventional management of constipation. Cascara contains anthraquinones, and these stimulate peristalsis by irritating or stimulating the intestinal neuromuscular apparatus. Stimulant laxatives like cascara may cause diarrhea and electrolyte loss, and so they're generally recommended only for short-term use. For more on herbs, supplements and natural treatment plans, check out my website.